Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real world content to help transform their future nursing practice. I enjoy taking the boring world of research and evidence based practice and making it come alive for my students. And that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and EBP course. David, Joan, Zach, Karen, and Rachel are joining us to discuss their evidence-based practice project. Before they get started with their discussions, I want to let our listeners know that I have shared a copy of these students' EBP poster to accompany this podcast episode. You can find this resource in the show notes in whatever podcast site you're currently listening to. Now, without further delay, let's turn the show over to Zach to get us started.
Hello, listeners. My name is Zach, and on behalf of my group members, David, Joan, Karen, and Rachel, I would like to welcome you to our podcast discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is Functional Recovery Related to Robotic-Assisted Rehabilitation. We are all undergraduate nursing students at McNeese State University in Lake Charles, Louisiana.
Thank you for introducing your team to our listeners and for providing us with a hint toward what your project's going to be about, Zach. I heard you mention the use of robotic rehabilitation, which sounds very interesting. Maybe some of our listeners have had joint replacement or other orthopedic surgeries that have required extensive post-operative rehabilitation services. If so, this might pique your interest. Even if you've never had those particular surgical experiences, it's always great to learn more about some of the cutting-edge technological changes that are impacting nursing and healthcare in general. So, Zach, can you tell our listeners why your group felt that your topic you selected was important for the nursing profession?
All right, everyone, let's break down the problem we're tackling. After orthopedic surgeries like total knee or hip replacements, patients need rehab to get back to normal. It's not just about easing pain, it's about regaining mobility and strength. Traditional rehab works, but it's got its limitations. It depends a lot on therapist availability and how well the patient sticks to the plan. Sometimes this leads to slower recovery. Now there's a new approach, robotic-assisted rehabilitation, which has been showing a lot of promise. Instead of relying on a therapist for every move, robots use technology to create more personalized and consistent therapy. They track bioelectric signals from the muscles to adjust movements, helping patients recover in a more controlled and efficient way. It also mimics natural motion and even helps with movement impairments. Plus, the sensory feedback from the robot could make recovery faster and more effective. But here's the issue. We don't have enough solid data comparing robotic rehab to traditional methods, especially when it comes to things like strength and range of motion. That's what this study aims to address. We need to know if robotic therapy can lead to faster recovery, less pain, and a better overall outcome compared to traditional rehab. If robotic rehab does speed up recovery and help patients regain mobility faster, it could totally change the post-operative care. It could reduce long-term disability and make rehab more efficient overall. That's the question we're exploring, and we are hoping our research will guide future rehab practices. Stay tuned as we dive deeper into the research and what it can mean for patients and the future of rehabilitation.
Thank you for explaining some of the key background information surrounding your topic, including some of the potential limitations of traditional therapy services. Zach, you mentioned some very interesting potential benefits of using robotic assisted therapy modalities, and I'm very interested to learn more about that. Now, David, can you tell us what your group did next within this overall evidence-based practice project?
I will be sharing with you all about our evidence-based practice question. In patients recovering from orthopedic surgery, how does robotic-assisted post-surgery rehabilitation therapy compare to traditional rehabilitation therapy in terms of the time it takes to regain functional recovery of strength and range of motion? Our group used PICO formatting to help structure our evidence-based practice question. P was our population, inpatient post-surgery, I was our intervention, robotic-assisted therapy, C was our comparison, standard traditional therapy, lastly, O was our outcome, rate of functional recovery and range of motion. Using this format allowed us to improve our focus and specification in relation to our topic.
Thank you for sharing your group's PICO question with our listeners, David. This question served to focus your group's investigations into the literature. Can you tell us more about how you used this PICO question to help you find published research studies about your selected topic?
We used our group's PICO question to create keywords to search the following university library databases: Academic Search Complete, Alt Health Watch, CNL Complete, Health Source, Nursing Academic Edition, Psychological and Behavioral Sciences Collection, Social Index with full text. Some of the keywords that we used for our research included robotic-assisted rehabilitation or robotic therapy, robotic-assisted and rehabilitation and orthopedic surgery, robotic-assisted rehabilitation or robotic therapy, orthopedic surgery or orthopedic procedure, or hip or knee, end effector or exoskeleton robot. We set specific search limiters on our searches included full text and peer-reviewed, quantitative, English language only, published between 2020 and 2025, and evidence-based practice. At first, we did encounter a few problems finding sources that fitted all of our literary research criteria. However, with our use of restructuring and mixing our keywords with modifiers, we were able to find all the necessary articles to complete our research.
I appreciate your sharing some helpful insights into your group's literature search process, David. I definitely heard the examples of how your group used Boolean operators like or and to link together your key search terms that you derive straight from your PICO question. That's an excellent strategy. Now, after your group reviewed the peer reviewed studies, what key evidence did you discover about your group's PICO question?
After conducting our literature search using the methods previously described, we sorted through the study articles to find high-quality studies that specifically address our evidence-based practice question. Each group member was responsible for critically appraising one study article, and we synthesized the studies into a guiding group synthesis table to get a bigger picture of the state of the science surrounding our topic. One of the biggest advantages of robotic-assisted rehabilitation is how well it improves range of motion. Research from Guarabanza et al. 2020 and Zeng et al. 2024 shows that patients who use robotic therapy experience greater flexibility and mobility compared to those undergoing traditional therapy. And that makes sense. These robotic systems provide precise, controlled movements, which reduce the risk of overexertion or improper technique, both of which can slow down recovery. Plus, studies by Catani et al. 2020 and Hamilton et al. 2021 highlight how robotic-assisted knee rehabilitation enhances early postoperative mobility and functional outcomes. That means these patients can get back to their daily activities much faster. Studies by Setoguchi et al. 2020 suggest that robotic-assisted therapy helps patients regain muscle strength more quickly than traditional therapies. These systems provide targeted movement support, ensuring that the right muscles are engaged without unnecessary strain. And let's not forget about the precision factor. Kotani et al. 2020 found that robotic-assisted therapy optimizes muscle activation and joint mobilization. This means patients are working the right muscle at the right intensity, leading to more effective strengthening and recovery overall. One of the most promising aspects of robotic-assisted therapy is its ability to adapt to individual patient needs. Zhang et al. 2024 suggests that patient-specific robotic-assisted rehabilitation is actually more effective in achieving functional recovery than traditional one-size-fits-all therapies. That's huge. The ability to tailor rehabilitation to a patient's progress could mean more effective and efficient recovery timelines. And there's another key advantage: safety. Right. Postoperative complications are always a concern. But Guadabanza et al. 2020 found that robotic assisted therapy can actually help reduce those risks. By guiding movements in a controlled and safe manner, these systems prevent overexertion or incorrect movement patterns, and that could cause setbacks. Robotic assisted therapy isn't just a cool piece of technology, it's a powerful tool that's reshaping rehabilitation.
Excellent discussion of the studies that your group reviewed, Rachel. I think I was most interested in the way that robotic assisted therapies could provide precise, individualized needs to stabilize certain muscles while mobilizing others to reach maximum functional recovery. That does sound promising. Now, Karen, can you tell our listeners about some additional key implications that nurses who work with these specific patient population should consider based on the literature your group reviewed?
When considering the advancements in robotic-assisted surgery, several key implications arise for nursing practice. One of the most important areas is enhancing patient education. Nurses, as the primary educators in perioperative, orthopedic, and rehabilitation settings, play a crucial role in educating patients about robotic-assisted surgical options, expected outcomes, and the rehabilitation process. This is particularly important in surgical centers and hospitals where robotic procedures are becoming more common. Another critical aspect is interdisciplinary collaboration. Nurses must work closely with orthopedic surgeons, physical therapists, and rehabilitation specialists to ensure seamless post-operative care. This collaboration ensures that patients receive comprehensive support from surgery preparation to full recovery, particularly in hospitals and rehabilitation centers. Post-operative monitoring and assessment protocols are another area where nursing practice must adapt. Nurses in acute care and post-anesthesia units must carefully monitor for pain management, mobility progress, and potential complications after robotic-assisted procedures. Establishing and strictly adhering to clear protocols is crucial as it can significantly enhance recovery outcomes and ensure patient safety. And speaking of protocols, data collection and research participation are not just important, but essential for evidence based practice. Nurses in clinical research and hospital settings should contribute to ongoing studies by collecting data on the outcomes of robotic assisted surgery. This will help refine best practices and improve overall patient care in the long term, making their work a significant contribution to the field.
Thanks, Karen. You provided our listeners with some very helpful takeaways that nurses working with patients recovering from orthopedic surgery should keep in mind. Importantly, I was happy to see that your group highlighted the need for interdisciplinary collaboration throughout the entire postoperative rehabilitation period. So, Karen, did your group find that there are any gaps in the present literature that may require further research investigations in the future?
That brings us to the importance of evaluating long term outcomes. Patient satisfaction is a crucial metric in comparing robotic assisted surgeries with traditional methods. Nurses in follow up care and outpatient clinics should assess patient experiences to help determine the effectiveness and benefits of these procedures over time. Now, let's discuss the implications for research. One major area that warrants further exploration is the long term comparison of patient satisfaction between robotic assisted and traditional surgical procedures. Studies focusing on patient experiences over several years can provide deeper insight into which method leads to better quality of life and recovery experiences. Another essential area for research is the cost effective analysis. Researchers need to investigate the financial implications of robotic assisted surgery compared to conventional surgery. This includes factors such as healthcare utilization, rehabilitation expenses, and overall improvements in patient quality of life. Understanding the cost-benefit ratio can help hospitals and policymakers make informed decisions about implementing these technologies. While we have gained valuable insights, there are still knowledge gaps in the existing literature. Further studies are needed to determine long-term patient outcomes, cost implications, and best practices for integrating robotic-assisted surgery into different healthcare settings. By continuing to advance research and refine nursing practices, we can contribute to the evolution of surgical care and patient recovery. And that's why ongoing research and collaboration are so important. Nurses play a crucial role in shaping the future of robotic-assisted surgery by contributing to patient education, fostering interdisciplinary teamwork, and informing data-driven decision-making.
Okay. So, your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all of the research studies that your group members reviewed, including any considerations for potential study weaknesses and the continued gaps in the present literature you just talked about, what was your group's overall literature based answer to your original PICO question?
After reviewing multiple research studies, our group was able to determine an evidence-based answer to our question. The evidence strongly supports that robotic-assisted rehabilitation enhances recovery outcomes by improving range of motion and muscle strength more efficiently than traditional rehabilitation. Studies suggest the robotic-assisted therapy enhances range of motion and muscle strength more efficiently than traditional rehabilitation by delivering targeted movement support, controlled mobilization, and precise therapeutic interventions. Unlike conventional therapy, which may be influenced by therapist variability, robotic system provides repetitive movements that optimize joint flexibility and muscle activation, ultimately leading to quicker functional recovery. Furthermore, robotic assisted rehabilitation reduces the risk of post op surgical complications by ensuring safe and guided therapy sessions, minimizing strain on healing tissues, which promotes gradual controlled progress. The integration of real-time feedback mechanisms allow for personalized treatment plans tailored to individual patient needs, providing both rehabilitation efficiency and patient adherence. Given these advantages, incorporating robotic assisted rehabilitation into standard therapy protocols has the potential to significantly enhance patient outcomes and shorten overall recovery time. Beyond our specific research question, this project reinforced the importance of evidence based practice in nursing. By critically analyzing research studies, we gained a deeper understanding of how advancement in technology can improve patient care. As future nurses, applying evidence based practice will be essential in making informed clinical decisions, advocating for the best patient outcomes, and continuously improving healthcare practices. Moving forward, we can apply what we learned from this research by promoting patient education on rehabilitation options, collaborating with interdisciplinary teams to advance post operative care, and staying updated on emerging technologies in healthcare. This experience has shown us that evidence based practice is not just about finding answers, it's about consciously evolving as healthcare providers to ensure the highest quality of care.
Thank you for wrapping up your group's discussion, Joan. I'm proud of each of you for integrating the content that we've discussed in our undergraduate nursing research and EBP course into this real world literature search process. You did a great job of providing the literature based answer to your group's EBP question. At this point, I would also like to thank our listeners for going on this journey with us. This is the fourth undergraduate EBP project episode that I've moderated that focus mostly on some sort of technology-based intervention. This once again highlights the need for nurses to stay aware of changes in their specialty areas. One way to do this is to join a nursing specialty organization. As a member of a specialty organization, you can network with other clinical specialists, receive specialty-specific updates on research updates, attend specialty-specific conferences, and potentially receive assistance or discounts for seeking certification within your specialty area. As always, thanks again for joining us today.